All right, as promised, a video about voice rest. If you have surgery on your vocal folds, or if you have had a vocal fold hemorrhage, chances are your laryngologist is going to suggest that you take a period of complete voice rest. Now, as of the time I'm recording, a lot of people hang in around a week. But the truth is, we don't actually know precisely how much voice rest you need for any of those situations. And the reason for that is because of the way studies are designed. So if you're going to design a study and you're saying, oh, we're going to have people have vocal fold surgery and then we're going to randomize them, meaning, you go here, you go here, you go here, you go here, with no planning for who's going to get what, then have one of those groups do no voice rest, just talk normally, and another group do the voice rest. The problem with that is that because we believe that voice rest helps the vocal folds heal, then it's not ethical to randomize people into a no voice rest condition. So we have to kind of extrapolate based on what we know from wound healing literature in general. And, there's some pros and cons to that because wound healing and skin outside your body is a little bit different than the mucous membranes in your throat. And then we can also extrapolate from people who don't follow the recommendations of the doctor and who talk anyway and see, well, gee, what tends to happen to those people. But of course, then as a scientist, you have to be thinking to yourself, well, what are the other factors that are leading that person to not follow the recommendations of the doctor? So does that mean that they're going to end up with another variable that would be the reason for their outcome, whether that's positive or negative? And so at conferences, we definitely have conversations about this. And it's kind of a little bit going to be based on just not totally understanding the point at which the vocal fold is healed enough to not experience some kind of scarring or buckling of the tissue after the surgery. And, that's just because vocal folds are too small and delicate to put stitches in. And so you kind of have to lay the ends together and hope for the best, right? Again, it's not a precise science in that way because we just don't have the answers. So that's why you might see people having different recommendations for that.